Welcome to Seeta Eye Center.
It's been a while since I've been here, but certainly Dr. Modi and I have known each other for a very long time, so I'm glad to be back.
Okay, well, let me just verify some information.
We take the most precise and accurate measurements that we can in our office. We have all the latest state-of-the-art equipment. We do everything we can to get your surgery as perfect as we can. We do a comprehensive consent program. We let you watch a video that'll let you see all the highlights of what to worry about and what not to worry about. We let you look at it one more time in writing. We'll answer any questions you might have and make sure you truly understand what you're signing up for. It's a big decision. It's one time in your life.
Cyprus, we already have established you have significant cataracts. Your night vision is really not great. And I can guarantee you what you don't realize is you're not even seeing colors like you should. You're seeing things more yellow than they actually are because of the brownness of the cataract. So we're going to take the cataract out. A long time ago I stopped using a surgical blade to do the procedure. I use a femtosecond laser. The laser offers more precision, more safety, and ultimately better vision. Right? So that's the methodology. The discussion really is, what do you want at the end of it, right? We can put, your glasses indicate that you have a fair amount of astigmatism, and the measurements show that you have a lot of astigmatism, right? We can put an implant in that'll give you good distance vision, but you're still relegated to wearing reading glasses for all close work, which includes a computer, dashboard, reading, so on and so forth, right? If you have a hankering to be able to function the way you did for the first 40 years of your life, we have an implant that will correct that. It's called the Restore. I was one of the FDA investigators that brought that to market. And it's a multifocal lens which will give you distance vision and give you near vision. And since we began with the Restore almost 12 years ago in this country, there have been 5 iterations on this lens. So we have the capability of doing the following. In your non-dominant eye, putting a Restore in that'll give you wonderful near vision and good distance vision. And then in your shooting dominant eye, put a Restore that'll give you intermediate vision and fantastic distance vision. So you'll end up with blended vision. You'll have great distance vision, you'll have computer or arm's length vision, and you'll be able to read fine print. Most implants, whether they're pacemakers, artificial hips or knees, need to be replaced every 10 to 15 years. The implant is made of the most biocompatible material known to mankind. It'll safely outlive you. It's good for decades. I've even put it into a 16-year-old kid who had a BB injury to his eye and developed a traumatic cataract, knowing it's going to outlive him. So it's totally durable.
That's a concern. And then the actual procedure itself, length of time?
The procedure is done under topical anesthesia, which means we use just drops in an ointment to numb the eye. There are no needles, no injections. We do have anesthesiologists present because most people, unlike you, are not spring chickens. You know, so we have anesthesiologists there to monitor your heart and your breathing and your vital signs, and they can give you something to relax you. It's a little Valium or something. But all you're doing is lying flat on your back for 10 minutes, looking up at a microscope light, and I talk you through the whole process.
Okay. And then the recovery period?
Is really minimal. The day of the surgery, you rest. Next morning I see you, you're totally functional. Caveats, no rubbing the eye. For women, I'll tell them no makeup for a week. And you'll have to use drops for about 4 to 5 weeks.
Okay.
But that's about it.
Okay.
So one word of caution,
Yes.
whether you have the multifocal implant or a regular implant, the time between the first eye and the second eye being done tends to be really discombobulating. All right, and you won't know that till you have the procedure done in one eye. But it means that something as simple as stepping down a curb or a step, you know, or climbing a ladder is going to become challenging. Your depth perception is going to be off. So after you have your first eye done, I'm going to warn you again to make sure you're very careful and you hold the banister at, you know, when you're going up and down a flight of stairs. Human beings are extremely adaptable creatures. It's only when you have a sudden ache or a sudden pain that you sort of scurry to a doctor and say, what's going on? All right, but when something happens gradually over months or years, you just sort of adapt to it. And it's not until you have the cataract done that you say, oh my gosh, I can't believe I was missing all this.
and I, was making adjustments for night driving, particularly in rain.
Right.
With the reflection off the road became really problematic, and that really
Wait till you have it done.
impacts
You'll see the
the
difference.
ability to go out and lead a normal life.
Absolutely.
So, good. Okay. Well, I am looking forward to this.
As are we. Thank you, sir.
Thank you.
Tom, there are still a few details that we need to discuss, so I want to take you back to my office. I want to go over
into surgery.
scheduling. I want to go over the financial impacts. There are many different things that we have to discuss in regards to the various options available to you, what your insurance covers, and we're going to go into specific details about all of that, as well as what to expect while recovering.
Okay.
Okay,
Good.
thanks.
Thanks.
The way that the multifocal implant works is it has 9 concentric rings in the central portion of the lens. I know that sounds a little crazy, but that's the way the optics work.
Right.
On each one of those rings, there's a staircase pattern, and believe it or not, there are little steps that are 2 microns. Each one of those planes is 2 microns, and just for a sense of scale, 1 hair is about 100 microns.
Okay.
So there's very complex optics in the central
Right.
portion of the lens. So a patient may very much notice an oncoming headlight just looking different than a natural eye. You will see those rings, but what happens over time is something called neural adaptation. Neural adaptation allows the brain to kick out things that aren't important. And we see that in so many different aspects in our life. So the brain learns how to use the lens, and after a period of time, the rings are something that either are not a bother or you actually don't notice them. And that A, you need the astigmatism correcting multifocal implant. That's what's going to give you the most precision. That there are those added costs, and obviously for each person the cost factor always becomes a little varied.
Right.
But there are costs. We do have payment programs. We do expect payment on the day of surgery for these add-ons. Just like anything, you pay with MasterCard, Visa, Discover Money, or checks, or you do a payment program.
Right.
And we try to offer really great plans to make it easy because we want you to be able to get the thing you want. Because the big thing with this is it's a permanent one-time decision.
Right.
This is the only time you get to do it. So basically at this point you just have to sign off on this, that you want it, and I'll give the chart to Dr. Modi. He'll finish all the calculations, and actually I'll call you the day before the surgery to make sure you're doing everything exactly as you're supposed to, so nothing slips through the cracks.
Individuals, eyes are one of the most important things that we have.
I think we all feel that way.
And it really does impact a quality of life issue not to have the kind of vision that hopefully technology and the skill here at the Seeta Eye Center allows people to have today.
I have to say we do a great job. Our experience is vast. We've been using multifocal implants since the early 2000s. We were early embracers, and at this point I would call Dr. Modi an expert by far, and Dr. Walter as well, of course. So it sounds like that's what you want. You have a good understanding. It's going to give you great distance. It's going to give you great reading. A couple little nuances, a couple little adjustments, learning to use the lens. It is a tool. You've got to learn to use it. But I think you will do great with it.
Good. Stacy, thank you.
Thank you.